Okay, so today I'm going to be talking about the differences between negative versus positive feedback systems, and then also kind of describing just the mechanism of a feed-forward control. So, negative feedback systems are anything that reverses a change in a controlled variable. So, most controlled variables in the body, things like body temperature, blood pressure, blood glucose levels, those are all regulated by negative feedback systems. So, a good way to just generally think about it is if the response reverses the stimulus, then the system is operating by negative feedback. So, in comparison, a positive feedback system is anything that strengthens or reinforces a change in a controlled variable. So, it operates really similarly to a negative feedback system, just in that the response affects the controlled variable differently, meaning it just strengthens or reinforces it. So if the response enhances or intensifies the stimulus, then it's operating by positive feedback. Some examples of that we'll go over is childbirth or milk letdown. So another good way to think about it is usually positive feedback systems reinforce conditions that don't happen very often. So obviously things like childbirth, that makes sense. And then negative feedback systems regulate conditions in the body that remain fairly stable over long periods. So things like body temperature, blood pressure are remaining pretty stable in your body. And then forward control mechanism is kind of different in itself. So that's just an event that occurs in anticipation of a change in a controlled variable. So one example that we've kind of talked about is, so if you just think about the nutrient concentration in your internal environment, when that becomes too low, you start to feel hungry. And if you see, smell, or think about food during that time, the feed forward mechanism causes your mouth to salivate and your stomach to secrete gastric juice. So that's basically an anticipatory response, which is part of the cephalic phase of digestion. And the goal of that is just to prepare the digestive system for food that it knows is about to be eaten, because most of the time when you see, smell, or think about food, your body knows you're going to be consuming it. So it's trying to prepare your digestive system to make it easier for the food to be digested and the nutrients to enter the internal environment. Okay, so now we'll just talk about an example of each of a negative feedback loop and then a positive feedback loop. So in this negative feedback loop, our stimulus is going to be a decrease in blood pressure. So blood pressure is our controlled variable. The receptors that are going to be activated are baroreceptors in the carotid sinus and the aortic arch. So our input is these will be stretching less, and so our rate of nerve impulses is going to be decreased. So the control center, there's the medulla oblongata in the brain and then the adrenal medulla. So these both act on different, have different reactions. So your medulla oblongata is going to have an increase in sympathetic stimulation, but a decrease in parasympathetic stimulation. And then the adrenal medulla is responsible for increasing norepinephrine and epinephrine secretion. So our effectors in this case are the heart muscle itself and blood vessels. So our output here is that we're going to have an increase in stroke volume and an increase in heart rate. And both of those things are going to lead to an increase in cardiac output. And then we also have constriction in our blood vessels, which increases the resistance. So all of those things combined are going to lead to an increase in blood pressure. So this is negative feedback because our response is meant to increase the blood pressure back to normal, which causes a return to homeostasis. So that's an example of a negative feedback loop. And then in comparison, an example of a positive feedback loop is, in this case, I'm going to be talking about childbirth. So our stimulus here is contractions of the uterine wall, and that causes the baby's head to move forward into the cervix. So with increasing contractions, we have stretching of the cervix, and that's acting as our controlled variable in this case. So the receptors are they're stretch sensitive cells, nerve cells in the cervix. So that leads to an increase in action potentials. And our control center in the brain, the hypothalamus, is going to cause oxytocin to be released into the body and then into the bloodstream. And then the effectors are our muscles in the uterine wall. And in this case, our output is going to be, or our response is going to be that they contract more forcefully. those muscles. And then in doing so, the more forceful contractions cause the baby's body and head to move forward and down more into the cervix, which stretches the cervix more. So in this case, we have an increase in cervix stretching, which causes an increase in oxytocin release, which again allows for the baby to move down as the contractions become more forceful. So there's more stretching of the cervix. So that's how the positive feedback loop works in this case, to increase stretching and then increase the baby moving. So an important thing to also note is that positive feedback loops can have an interruption in the cycle, which stops the cycle. So in this case, talking about childbirth, the interruption here would be birth of the baby. So that decreases stretching of the cervix and breaks the cycle. So those are some examples of negative feedback and positive feedback loops. It really helps me to write them out and talk about it as I do it. So I would suggest doing that if you struggle with these loops. So yeah, thank you for listening.